And we are happy to welcome with us 1st District Congresswoman Chellie Pingree, who joins us now to talk about some of the latest developments on health care reform. Good to have you with us this evening.
Thank you so much.
So the House bill passed. It's now moved on to the Senate. What do you think the chances are at this point?
You know, I think that the Senate is going to want to act on this bill. I think the fact that the House could finally pass a bill with all the, back and forth that had to go on to put together a bill puts the pressure on the Senate to say, of course it needs to be modeled in the way that they want, but it has to be done. And I think the President will also be encouraging them, just get a bill out so that we can start the back and forth between the two bodies of the legislature.
Of course, the House version, though, does include a government health insurance plan. There are a lot of senators, even some moderate Democrats, who are not happy about that. Is that just going to kill the bill at this point, do you think?
Well, I think the strategy coming out of the House, many of us believe that's really important for competition and bringing down the cost of insurance. So our feeling was the House bill has to be as strong as it possibly can. Who knows what will come up in the Senate. Obviously, Senator Snowe has been a leading proponent of the bill. She suggests putting a trigger on it if we have the public option. So I bet there will be all kinds of combinations of how this gets put together, introduced. I do think they will vote on a final bill, though, and I know there's a lot of pressure to do it by the end of this year.
Yes, I was just going to mention that. Of course, that's the President's hope. But do you think, honestly, it's going to be this version, or do you think there's going to be another compromise version that's going to be discussed?
Oh, there will be another compromise version. You can't have, the push and pull from the Senate to the House without some kind of compromise reached in the middle. But if they don't pass a bill, we can't start negotiating with them. So that's the important thing. That's what I hear the most from people. We get into the weeds because we're down there in Congress, but when I'm back here, people said, can you get the bill done so we can at least start moving forward? This won't happen overnight. And what the country needs is really to start moving forward, revising our system, doing the things that we need to do to bring down the cost.
All right. Thanks so much for joining us this evening. And a little later in the show, we'll talk live with Senator Susan Collins. Back to you.